Hello and welcome to SimCast, the higher education simulation podcast. My name's Tony Jeremy. I'm the academic lead for simulation-based education at UEA Norwich.
Hello everyone and welcome back to SimCast. I'm Lawrence Hill. I chair the simulation group in the School of Health Sciences at UEA Norwich.
And today we're joined by Amy Wong.
Hello everyone.
Hi Amy. And what are we going to be talking about today?
Today we're talking about all sorts of good stuff. We are talking about simulation as an international language. We're talking about simulation as a vehicle for scholarship and an engagement activity. And we're learning all about the fabulous Dr. Amy Wong, who's kindly joined us today in the studio. So thank you for coming along, Amy.
It's my great pleasure.
Thanks, Amy. If you enjoyed the episode, give us a like. Equally so, if you didn't like the episode, give us a dislike, but let us know in the comments why, because we're always keen to improve. To keep up to date with all things Sim, subscribe to the channel and don't forget to check that notification bell. And SimCast is available on all popular streaming platforms.
So then, Amy, it'd be really nice just to get to know a little bit about you and if you could tell us a bit about yourself. So what's your background as an educator and how did you get into higher education?
Well, I think it is a very good question. And I got into the health profession education in a rather unusual way. I was actually originally trained as a secondary school teacher in Australia. And after graduation, I taught in a regional area in Queensland, about 200 kilometres away from the Brisbane city. When I relocated back to the Brisbane city, I couldn't find a teaching job. But I still really passionate about education. And I thought I may try to go into higher education. So I put in my job application at the University of Queensland. And my first job was landed with the School of Medicine. That's where I started my interest and my passion about medical and health professions education. I finished my PhD in looking into OSCE examiner for my PhD study in 2019. And after that, I relocated to the UK.
Fantastic.
Great. It's quite an unusual intro into higher education for health education, isn't it? Because normally people have kind of clinical backgrounds.
Yeah.
So to come from teaching, I always feel like a bit of a fraud when I'm in higher education because I haven't got that conventional educational background. You come with your clinical experience, whereas you've done it the other way around.
Wow, I definitely feel the imposter syndrome, like when I'm talking to clinicians. Yeah, same.
Well, I think we do the same.
But how interesting though, that experience of coming into healthcare higher education without a healthcare background must have given you some unique insights and been able to ask some really, I don't want to say naive questions, but questions that no one in the establishment would have asked.
Seeing the wood through the trees.
So what was that experience like of breaking into healthcare education without a healthcare background?
Well, it's challenging, but I think it's because of that challenge that kept me going every day, because I can unpack a lot of the sort of in terms of educational practice from an educator point of view, and like colleagues in health professionals, and they're very kind and they're very open-minded to know about education, because at the end of the day, they need to teach the next generation to make sure that we provide a high quality of patient care to the public.
And that's in everyone's interest, isn't it? Let's say, I guess from that perspective, you don't need to be a healthcare professional to uphold those values and ensure that education is as good as it can be.
So you're at the Norwich Medical School now.
Yes.
What's your role in the organisation now?
So I'm the Associate Professor in Medical Education with the Norwich Medical School. And for teaching, I'm predominantly working with the Clinical Education Program team. And I'm the module lead for the dissertation module. And it's a really good fit to my interests as well, of my passion about health professions, education research, because I can actually cultivate the next generation to look into medical education, health profession education from a different perspective.
Yes, indeed. And we've had some interaction, haven't we, with regards to the Masters in Clinical Education and the introduction of our simulation instructor course.
Yes.
And yeah, what did you make of that?
I think it's really good, and it's just giving students, particularly integrating students, a different perspective. When they sit at the educator or assessor's side of the table, they understand the process of doing assessment, the reason why simulation needs to be incorporated into the curriculum shouldn't be a sort of standalone thing, and it needs to be really well thought through. And I think it's really, really useful for the students to think from that perspective.
Yeah.
And what was your first experience of simulation in education?
My first experience, it's sort of back when I was in Australia. And then we talk about simulation, not just about the technology, it's about the technique, how we sort of teach or support students, particularly working in the group with simulation based, I guess, mimicking the real life situation and then developing particular skills like in communication, in teamwork, working together collaboratively with colleagues from other disciplines.
And talking of working together with colleagues from other disciplines, you lead a research and scholarship group, don't you, within the faculty?
Yes.
Could you tell us a bit about SIReN?
Definitely. Like SIReN is my baby. Like, yeah, it is. So SIReN is in Health Professions Education Scholarship Innovation Research Network. So the reason of setting up this network is that when I started at UEA for about 3 months, and with my observation and talking to colleagues, there are lots and lots of innovative and high quality educational practices happening across the faculty. But no one knows about it. Like both internal to UEA and external to UEA. To be very honest, I haven't heard of UEA before I put in my application for the job in here. So I think it's such a missed opportunity for the world to know all the good things that we're doing at UEA. So I sort of decided that, and with the support of the senior management, I need to set up a peer support network as a platform for colleagues to share ideas about what they do, and then to think of ways to disseminate the good practices like nationally and internationally.
Well, we struggle with that even between the faculty, don't we? The faculty, the School of Health Sciences and School of Medicine. There's lots of great work that's going on that we don't even sometimes realise that happening in the kind of the neighbouring schools. So getting that message out there.
Definitely. And there will be loads of educators, I think, listening to this, particularly those that come from perhaps a more conventional healthcare background and moving into education. That transition into seeing yourself as a scholar and as a researcher does require that peer network of support to make that transition from that outright imposter feel, as I certainly have felt. And when you said, would I be happy to lead the simulation component, I was a bit like, what, me? Really?
Yes.
And that's the thing, So can you tell us a bit more about SIReN? Like what's happening in SIReN at the moment, and what are your aspirations for what it might do?
Well, we actually co-designed the mission and vision, because SIReN is not my SIReN, it's everybody's SIReN. So we need everybody to sort of agreed on the mission and vision. So the mission is really to develop medical and health professional within UEA and increase our reputation of this area of excellence nationally and internationally. And really the vision is to provide a peer support network to consolidate the networking within and outside UEA, looking at co-designing evidence-based practices with colleagues and with student partnerships as well. That's really important to include students in the teaching and learning practices, as well as like how to think of innovative way of how we can disseminate. Yes, journal paper is a way of disseminate our impact, but there are other ways that we can make an impact of teaching and learning in health professions education, and how we can do it together.
That's one of the reasons we set this podcast up, wasn't it?
Yep, that's exactly it. Yeah, there are real parallels there. That it's about sharing of good practice and trying to create a community and a movement. So, I'm surprised it's taken us this long to get you on, to be honest.
Queuing up. So we talked a little bit about what you do. What about why you do it?
Well, I love education.
Okay.
And I love teaching. And I guess teaching secondary school students give me a really good foundation of teaching practices. But moving into higher education practice is really open up to the world of how can I actually put some theory about teaching and learning into practice that can actually enhance the delivery of patient care in clinical practice. And I think that seeing colleagues to develop from a novice about medical health professions, education research, to be able to present their findings in conferences and other presentations. It is really a really fulfilling, rewarding journey for both the learners and myself.
Great.
Yeah, so
that passion is a great driver, isn't it?
There's that real nurture thing going on there as well, and that really speaks to my own kind of philosophy of education and practice. So no wonder we get on, Amy. That's great to hear.
Just quickly before we move on, what for you is the big difference between secondary education and higher education?
Working with colleagues, they are really motivated to be better educator, and it's really easy to sort of, because we're sort of on the same page, and it's really the innovation, the motivation and inspiration really sort of move things along faster.
Okay.
I suppose because secondary education is so much more constrained by national curricula, that there's less flexibility.
Yes, and it's a lot more assessment driven as well.
Right.
Yeah.
Simulation isn't all about assessment either, is it?
Categorically not. No.
Shouldn't be.
Contrary to popular belief.
Contrary, yeah, exactly. Okay, great. Well, let's start to sort of segue this into. We were really. It was important that we talked about the international potential of simulation and the kind of some of the things that might come out of that. So, but be interested to know, what role do you think simulation has as an international language and kind of opportunity for collaboration?
Yeah, let me answer the questions of the collaboration first.
Yeah, of course.
We talk about that simulation should be really carefully thought through and to be integrated as part of the curriculum to achieve the learning outcomes of working together. And simulation itself lends really closely to collaboration, because really when we think that simulation, we want to mimic a real life situation, and for the learners and for the clinician to sort of practice skills in a psychological and physically safe environment. And essentially, this is what happened in the real world, because it's very rare that only one discipline of professions working in dealing with an incident. So there's real opportunity to, particularly for interprofessional education and practice, for simulation to sort of further think and develop in that particular way.
I like that. That's a really interesting thought, that the very nature of simulation is that it is collegiate and interprofessional because it's reflecting practice. No, that's great. Okay, yeah, fair enough. So carry on, yes.
Yeah, and I'm sort of thinking about an international language, and I think there are real scopes of research and further exploration in this area, because I remember that in a Sim instructor course, we sort of, both of you sort of briefly talk about the language that we use in simulation, about high and low fidelity of simulation, whether fidelity is the right word to describe simulation, and the associated meaning and connotation in relation to teaching and learning. I think that's fascinating, and there definitely group scope for further collaboration to develop a mutual understanding of the wording as well.
Because if you want true collaboration, we've all got to be singing from the same page, haven't we? And that boils down to something as simple as using the same language. And there's definitely an episode I think we're itching to do on the really simulation language.
Yes.
Watch this space.
Yeah, definitely. That's super. And I'm really pleased that the Sim instructor course has made you think about that. But there are international collaborations in the offing, aren't there, around simulation?
Yes, and I guess from our own research, looking at assessor support, particularly in assessment across discipline. Yes, there are specific or distinct differences between disciplines in terms of assessment, but there are a lot of similarities as well. So I understand and respect that we need to acknowledge the differences of different disciplines, but also there are opportunity for us to build on the similarity to develop a mutual understanding what simulation is across health professions.
And between professions, there's an opportunity to learn something, but with international kind of simulation, there's also that opportunity for kind of shared cultural understanding as well. And because if you have international collaborations, it's likely to be variation between the kind of cultural identities of the people involved. So a huge opportunity there as well for that meshing of culture that comes out of the process of learning about each other through sim.
Yep, definitely.
You mentioned a little bit about coming on to the simulation instructor course, which is obviously designed for faculty development. So what are your thoughts on simulation faculty development in the wider context?
Absolutely essential. Like, I know that a lot of time have been put on great effort putting on designing the actual simulation event, but the whole learning of simulation is actually start at the beginning with the briefing, and then setting up learners' expectation of what they need to do, really clarify the role of different stakeholders in the simulation event, and then do the simulation event. But learning shouldn't stop at the end of the simulation event. The very large part of learning that I would say is happening in the debriefing session, because if we done one thing, if we sort of say the facilitator say one judgmental comment about the participants, all the efforts in trying to develop the psychological safe environment is just gone out of the window. So I think it's important to sort of focus faculty development, particularly on briefing and this debriefing, because they go hand in hand together, and it's really consolidate the whole simulation-based education or training event.
Yeah, and simulation is becoming so much more prevalent in health professions education. And I think that there's room, isn't there, for learning to work out how, the pedagogical approaches used in simulation integrate with existing curricula, and whether you can integrate simulation, or whether you have to start again and say, actually, is this going to have a simulation in this curriculum? And if so, how do we integrate it? And so it's a kind of a whole approach, isn't it? It's a kind of a whole pedagogical approach that I think that people are aware of, and they think this is really good and really important, and I like it. And the answer to our practice problem is probably simulation. But how do you make sure that sits within a coherent program? That's another question altogether.
Exactly. Is a lot of literature, particularly looking at the interprofessional education, it never going to work if we sort of see it as a standalone learning experience for the students, because of the time, the resource constraint, and it's exactly the same as simulation. We can't see it as a separate add-on learning activity for the students. We need to build into the curriculum and align with the learning objectives.
However, unfortunately, so many times that's the way it is, isn't it? That's the reality, is it's seen as a separate entity.
Yeah.
So if you had a magic wand, what would you do differently?
Well, it's just like we need to really align of what we want the students to become at the end when they finish the program, and then think of a way of incorporate simulation in a sustainable way, so that for the students to sort of have the opportunity, not just one opportunity throughout their 3, 5, 4 years with us, but it's just opportunity to be in touch with the simulation learning experiences throughout their learning journey.
So what I'm reading from that is it has to be integrated from the curriculum from the ground up.
Definitely.
Doesn't it?
And I think one of the reasons for that is because I think learners have to, and we talked about this on a previous podcast with one of your colleagues, David Aziz, about actually learners have to learn how to learn in simulation.
Yes.
And if they're having this kind of very small kind of exposure, that opportunity to learn how to learn in sim is not there. And I think that just makes me think, how can we better equip students? And actually that would be a really good opportunity, just as a quick call out here to anyone that is listening. Be really interested to hear what training you give your students about how to prepare them for being good simulation learners.
The pedagogy of simulation. We learn about it as educators, but actually the participants, the learners need to understand that as well. You're right, because otherwise you can do everything in your power to create a psychologically safe space for a session. But if they don't know what simulation is about, they're on a hiding to nothing, aren't they?
So any comments about that would be really welcome. But I guess this leads into the kind of our next question really, which is about what can we do in terms of scholarship and research and innovation. So what do you think we can do to generate more research and scholarship using simulation-based education as a vehicle to do that? What do you think, Amy?
So research and scholarship. Okay. Well, I think my very first tips is purposeful planning of what you're going to do, because a lot of the time we're doing, like apart from simulation, a lot of the teaching and learning practices we do, we actually lend itself very well to scholarship and research, but we just need to plan ahead.
Yeah. There's loads of good quality stuff going out there, but are people thinking this could be good research?
Yeah.
or
So,
good
so
scholarship?
to those educators out there thinking, what does planning ahead look like to you?
Be bold and curious.
Okay.
Yeah. So put forward the question that you would like to further explore. Find like-minded colleagues like both of you to work with me. Two heads are better than one, definitely. Getting the students on board will put another perspective in your project as well. So focus on your question, plan and structure what is required before and after the simulation event, and how are you going to collect the required data. Do you need to collect data beforehand? Do you need to collect data during the simulation by a observer? And what sort of data that you would like to collect afterwards? Plan it 6 months ahead, thinking about that you will need time for ethics application as well, because a lot of the journal now will need ethics application for publication in the particular journal. So
and that's an absolute key.
And I'm assuming try and have a conversation with someone who's comfortable with that, because ethics, I guess, could be a bit scary if you're going to go through it for the first time. So work with someone who's comfortable doing with ethics, can help you through it. But certainly thinking about those extra steps that you have to jump through. And it's about, I guess, going back to your point, it's about, instead of how are we doing simulation, it's why are we doing simulation, and asking that question to start with, to then look at how it might generate scholarly or research activity.
And the other thing that I think is really important is to think about how you engage with the theoretical underpinning as well. So I know theoretical underpinning is like, can scare people away, but I think if you
No, carry on. As much theoretical underpinning as you've got, throw it at me.
Don't get started.
But I think if you think about, start to brainstorm that, think about what theoretical underpinning that you're going to use from the start of your project to inform your design, the methodology and the data collection and analysis, rather than an afterthought, it can actually help you to design and think about your research and scholarly activities as well. And I really like how both of you frame the simulation learning with the COPE cycle of learning.
Right.
But I suggest that we could go a step further with the theory, not just using the theory, but really develop a two-way conversation with the theory. Ask the questions around COPE cycle of learning in terms of stimulation and how you can use the finding of your research project to communicate with the project, to build on the project. That's your contribution.
Great.
Well, I can sense a simulation instructor course, pedagogical evaluation in the offing. So I'd love to pick that up with you once perhaps we finish recording here and talk about how we might do that. So be purposeful, plan ahead, engage with the theoretical underpinnings of the approach that you want to take and of the learning theory that underpins it. Anything else? Any other kind of ways that you think that we can start to think in a more scholarly way about the simulation work that we do?
I think it's very important that Tony sort of say, why? Ask the why question, be curious, and then plan ahead. Talk to your colleagues, join networking so that you can broaden your scope of research and collaboration. And it's really important that we work with colleagues within the UK and also across the globe as well.
And I think it's about changing your mindset, isn't it? Because I'm sure there'll be a lot of educators out there, and please stick a comment below if you're one of these people who is responsible for delivering simulation, and it's that functional. I need to deliver a simulation event. I need to do a topic on this, and then, like you say, they get so kind of engulfed by I have to deliver it, and I have to plan it, and I have to do the nuts and bolts, the practicalities, that they're not thinking necessarily about the why. Even going back to the learning objectives or the outcomes to start with would be a great place to start, but changing that mindset.
Yeah, And then can I encourage everyone to be a little bit selfish? Like you really need to carve out time to think about, yes, I know but all of us know that we need to deliver, but think about how we can use the opportunity to advance our involvement in research and scholarship activities as well.
Which is really getting from a clinical background, that being able to say no or carving out time doesn't come naturally.
No, I'm still learning it. So.
Okay, smashing. So we've touched on the activities of SIReN to some extent. Is there anything else about SIReN that you wanted to pick up and talk about? Because it's not just about simulation, is it? It's about a whole host of different things. So I wondered if there's anything that SIReN's been up to that you wanted to talk to us about, or if there's anything that you feel you really want to take this opportunity to speak about. Shameless plug time.
Yeah, if you want to join, send me an email.
Great.
Well, I'm really, really pleased how SIReN is going. I really only set up this network in August 2023, and we have more than 40 colleagues across the faculty who've joined the network. So I'm serious. If you're interested, please drop me an email. And simulation is one of the key themes that we look at for this year and next year, alongside with assessment and feedback, EDI, mental health, well-being, and digital learning. So this really sort of important topic around teaching and learning that I want to sort of get colleagues to think about how we can together enhance the practices in this particular area.
Potential silly question, but external contacts and contributions as well?
Yes. I'm really, really, really pleased that we are very, very successful in having a very strong representation at the annual Association for the Study of Medical Education, which includes the health professions education as well, annual scholarship meeting in July. ASME. So I think it's the very first time that UEA have a very strong sort of presentation in this particular meeting. We've got students, we've got colleagues, we've got teaching fellows that have abstract accepted for presentations and workshop. So
fantastic. So if we put your contact details to the words out your mouth.
Are you okay to have your contact details in the description of the video?
Yeah, definitely.
Fantastic.
Great.
Excellent stuff.
So if you're interested in engaging with Amy in regards to the activity of SIReN at the Faculty of Medicine and Health at the University of East Anglia, please drop Amy an email, and we never know what might come out of that.
Yeah.
Fantastic stuff.
So something else that you do doesn't really seem possible, but
so many strings to your bow.
So many strings. But something else that you do, which actually I have to, I'd like to sort of publicly give you a big shout out and a big thanks from me for your support with this. But you're leading the faculty in relation to fellowships of the Higher Education Academy, Advanced HE fellowships. And supporting people to apply for fellows and senior fellows and principal fellowships and so on. So how do you think we can harness simulation-based education as a way of unlocking these fellowships for people that are out there listening?
Wow. Well, I think, so just sort of let people know what Advanced HE Fellowship is all about. It's really about demonstrate a commitment to professionalism and provides recognition for practice, impact, and leadership in teaching and learning. And there are 4 different categories: associate fellow, senior fellow, and principal fellow. And thinking about the range of individuals who are involved on simulation-based education, such as the facilitators, the director, even the technicians, we definitely shouldn't miss the opportunity to harness their experience of supporting sim-based education and encourage colleagues to apply for this for the Advanced HE Fellowship. If you apply directly to Advanced HE, usually involves some sort of narrative reflection of your teaching practices. So I would encourage you to have a logbook and to sort of start to write down examples of what you have done in terms of teaching and learning, or how you support teaching and learning. And that would be a really good starting point to think about Advanced HE's fellowship.
So essentially lots of people are probably doing lots of great work towards it already. And it's just, again, thinking smarter about how you might reframe that in towards a submission for a fellowship.
Yeah, and just sort of collecting evidence that addressing to the professional standard framework. And give you an example, their framework are quite general in a way, say how you apply knowledge of different approach to teaching or supporting teaching, show how you collaborate with others to enhance practice, demonstrate how you design or plan learning activities or programs.
Yeah, it sounds like
Ding,
simulation.
ding, ding.
Yeah, so
Exactly.
I'm sure that everyone listening would have ding, ding, ding.
Yeah.
It's just a matter of like write it down and to reflect on your experiences.
Yeah, brilliant. Well, I think that's huge because I guess in a way they're more than markers of prestige, but they represent your kind of commitment and your dedication to kind of on the sort of associate fellow and the fellowship end. They're really focusing on how you enhance learners, aren't they? And then as you kind of progress through there, about how you advance programs, and then finally how you influence other educators and things at a system level. So there's something in there for everyone.
Definitely. In July 2023, quoting the evidence statistics, there are over 174,000 fellows across the world, and it is a national and international recognition.
So that's what a club to be in. Yeah, definitely. Oh, that's great. No, thank you for talking to us about that, because I think that's something that people don't automatically think of when they think about simulation. Is actually these are entirely justifiable activities under the Advanced HE kind of fellowship system.
Yeah, same thing with scholarship and research as well, isn't it? It's there bubbling in the background, but it's people having kind of
the confidence
and it being at the forethought of their minds rather than, again, it being this kind of procedural thing. So I guess transitioning into our kind of closing questions. So you've got educators out there doing all this great simulation activity, probably delivering sim, maybe not thinking about scholarly activity or research or even applying for a fellowship. What's your kind of key take-home piece of advice to those individuals, do you think?
Okay. 3 I's. Be innovative in your development of educational practices. Think outside the square. Go international with collaboration to create change. Be inspirational to shine your light to transform practices.
Wow. What a lovely way to end.
Yeah, definitely. Well, that is inspiring.
Thank you so much, Amy, for coming to join us today.
Thank you for having me.
It's been really interesting and insightful.
Yeah, it's been great having you on, Amy. Thank you so much.
And it's given me some food for thought as well.
Yeah, definitely.
It's always good to sort of like bring this back to the forefront of your mind.
Yeah. Yeah. So when are you starting your PhD?
I'm really enjoying what I'm doing at the moment with that PhD on top of things.
We'll work on them.
I have your email.
Amy, thanks again so much. And thank you all for listening in to this episode of SimCast. We hope you've enjoyed it, and we'll see you on the next one. Bye for now.
Thanks, everyone. Bye-bye.